today's session we put together because we know that managing medications is a really large part of keeping your care partners well. And over time, many conditions call for more and more medications, more treatments, and staying on top of those things can be really challenging. For many caregivers, this is an essential part of supporting a loved one's health and well-being. But again, there's a lot of challenging aspects. Medications change. Again, multiple prescriptions are involved. There can be concerns about side effects and interactions as we layer more medications on top of each other. So today's session is designed to provide practical information and strategies to help caregivers feel more confident and organized in managing medications safely. So we really want you to leave this morning's session with valuable tools and resources that you can apply in your caregiving role. So I'm going to move on and introduce our speakers and let them take the floor. So we have the main part of today's presentation will be presented by Marta Madzelen, an experienced primary care pharmacist with CarePoint Health, and she will be sharing her expertise in answering your questions. So Marta has extensive experience in patient-centered medication management across primary care, academic, as well as research settings. She worked closely with interdisciplinary teams to optimize medication use and improve patient outcomes. Marta has a special interest in chronic pain management, opioid stewardship, and comprehensive medication reviews. She holds a Doctor of Pharmacy and Bachelor of Science from the University of Toronto and is committed to delivering evidence-based and collaborative care. So a very warm welcome to you, Marta. I understand Farah will be opening. So Farah is also with CarePoint Health. She is our health promotion specialist or educator with the team. So she's going to talk a little bit to open about that program there at CarePoint Health and how it can support you as well.
Hi everyone, I hope you can all hear me okay.
Yep, we hear you.
So yes, thank you for the introduction. I'm Farah, I'm the health promoter with CarePoint Health. So CarePoint Health is an interprofessional care team of allied health professionals and primary care physicians, all working together to improve the health and wellness of the Mississauga communities. So our team really takes a more holistic approach, like a really well-rounded approach to health, focusing not just on your physical health, but also your mental and emotional parts to make sure you're living a really good life. So I just wanted to introduce a couple of our programs that are more specific. So does everyone here have a family doctor? If you do not, or if you do, please, you can write it in the chat. So finding a family doctor can be really complicated sometimes. I don't know if any of you have ever done it. So we have our Access Primary Care Mississauga program, where I'll put the link in the chat if you do need a family doctor as well, where basically we connect people to family doctors located in Mississauga. It's a really simple process. You basically register online, or you can even call in and sign up that way if that's a bit easier. It's really important to have ongoing care from a family physician, especially if you have any chronic health issues or you are caring for someone that has chronic health issues. You don't want to be constantly going to walk-in clinics. You're not going to get that continuity in care, which can be really important if you do have any major health concerns or even simple concerns like allergies and asthma. You also don't want to be constantly going to the emergency room because long wait times, you're kind of adding to that as well and to the overload of the system. So it's really important to have a family doctor. We have over 130 affiliated physicians at CarePoint Health. So, and those are all doctors in Mississauga that we can connect you to. We also offer free mental health support for anyone 18 plus in Ontario experiencing things like depression or anxiety. And yeah, all of our therapy is cognitive behavioral therapy based. So there's a lot of different formats to get this support. There's online self-led support. Virtual, you can have virtual calls with a therapist, psychotherapist, or phone calls, and even you can meet in person. And this is a really awesome service because sometimes getting a session with a registered psychotherapist can cost upwards of $150 to $200. And with this program, you can get 6 to 12 sessions completely free. The wait times approximately are about like 1.5 months currently. But sometimes you can get in a bit faster. And the initial intake phone call is only 15 minutes. So it's a really great program if you or anyone you need support and is 18 plus. This is a really great, amazing program for people. And thank you so much. I appreciate you taking the time to listen, and I'll put some links in the chat for everyone.
Thanks very much, Farah.
Hey, thank you so much. So my name is Marta, and thank you so much, Michelle, for the wonderful introduction. I'm just trying to minimize this while I get my slides going here. I'm really excited to be here. Thank you so much for inviting me here to talk about how to manage medications when things can be so overwhelming and complicated these days. So as mentioned, I'm a primary care pharmacist at CarePoint Health. And with this topic, I hope if you're somebody who helps family members or friends with their medications, I hope that you would be able to take something away. These next 45 minutes or 40 minutes are for you. And by the end of it, you would have some practical tools to manage medications more safely. I always start with just some general housekeeping. This is very general information provided, and it's not meant to replace specific medical advice or medical advice about medications. So please do not stop, start, change any medications based solely on the information presented today. And I don't have any conflicts of interest to declare. And of course, questions are welcome. I'll try to make sure we have some time at the end to really get through them. So today's objectives, we want to start with understanding what medication management is and how would we build a medication record, also everyday safe strategies that are practical, learning how to talk with our healthcare team, and also just knowing how a pharmacist can help you and your loved ones. So I like to start with a very quick question. There's no poll. It's more of like something to think to yourselves around what percentage of older adults in Canada take 5 or more prescription medications. And this is something, as seeing the numbers might come as a surprise, might not come as a surprise, but it's actually a large amount. So if you're feeling like managing medications is a lot, that's because it is. I mean, just look at the statistics. 66% of older adults take 5 or more prescriptions, and 1 in 4 take 10 or more prescription medications. And as that number increases, like Michelle mentioned earlier, so does the complexity. So does that increase risk in side effects, drug interactions, falls, hospital visits. So we certainly, this is a very important topic. And oftentimes we'll hear this term maybe thrown around called polypharmacy. And polypharmacy, it sounds technical, but it really just means taking multiple medications. A lot of times people will write in guidelines 5 or more, which is a nice little guideline because at that amount, it shows that there can be higher medication related issues. But it's not just about the number. It's also about whether each medication is appropriate, if it's working well, because even a small number of medications could cause problems that are unnecessary. And so why medication matters is that the goal isn't to have the fewest medication possible. The goal is to have the right medications taken safely, effectively, that supports your loved one's health and quality of life. So what is medication management? And this is just a big picture overview. And what it is it's about understanding, organizing, taking, and monitoring our medications. So understanding our medications is not just that's the white pill or the blue pill, but knowing what it's for and making sure that the medications are taken at the right days, right times, that they're actually taken as directed and prescribed, and that we monitor. Now, starting a medication and monitoring that is usually pretty straightforward, and people are very aware of that. But watching it over time is where caregivers make a tremendous difference, right? And so it's just something to always keep in mind, like, is this medication still helping? Is it causing any problems? So when we put all these parts together, medication management starts to become more than just remembering pills. So what this all ends up creating is that doing all of this, what does it do? And good medication management actually has so many benefits. There's some are very obvious that if when we do this correctly, it can reduce side effects, drug interactions. It can make taking medications easier at the right time. But more importantly, some people think it just takes up a lot of time and energy, and it feels like that maybe right now. But a good system actually saves you time and reduces stress. And a good system can also even result in taking fewer medications because it can prevent unnecessary medications from accumulating over time. So how do we do this? This is sort of a big summary that's about 5 practical habits. They're simple, but they make a huge difference. So the ones that we're going to go through today are keeping an update list of medication record and lists, booking a regular medication review, taking medications correctly, staying organized, and monitoring for side effects as mentioned. So the first step I always like to start with is an up-to-date medication record because I think of it like a roadmap, right? So it's a lot harder to navigate around someone's health when we don't have this full picture of, what we took or how we're taking it. So before we talk about organizing and reminders and schedules, we want to start with that record. So what goes into a record, right? Now, this seems like a lot, but really what it is like a story about your medications or your loved one's medications. So it includes the medication details, the reason for use, how they take it, whether it's working, where there were any side effects, were there any changes over time. And in my experience, what's often missed are those past medications that have been used and why they were stopped. I know the doctor typically will have that information, but sometimes years down the road, things change so often. And then that conversation tends to come up in my experience is like, oh yeah, I think I remember taking that. I can't really remember. And then it's even harder to bring out that information when there are multiple healthcare providers over time. So, and then the other part that sometimes confuses many people is knowing a difference between an allergy and an intolerance. So an intolerance is like a bothersome side effect, and allergy is a true reaction. And that alone, knowing that difference can change prescribing for your loved one a lot. So I encourage you to capture your loved one's experience with the medication and how it made them feel, and then bring it up with your pharmacist, nurse, doctor to identify whether that's a true allergic reaction or not, right? So here's where a lot of patients maybe sometimes run into trouble is that sometimes they get a little confused between what a medication record is and what a medication list is. And a record is sort of like this master document. It's like a whole history story around where we started with our medications and how they've changed over time. Having that all in one place is so, so helpful, and it tracks that for you wherever you go to whatever appointment. A medication list is also very important and to continue to keep updating. And then a list only lists current medications, current doses, current and allergies as well, and the pharmacy contact information. And it's a lot harder to see those differences now, but you will have a template copy of each type of document so that you are able to see that for yourself. And I'll show you an example of each one. And both of these are very valuable to take with you to all your appointments, pharmacy visits, hospital visits, and so on, so that safer decisions are made for medications. So an example of a medication record that you'll get in the template, you'll see that there is, the name of the person, emergency contact information, list of allergies or intolerances. And I did a little example around here at the bottom where it shows the medication name someone had filled out, how they take the medication in the evening, the reason for its use. The start date is always very helpful if there is a stop date, or if it's what's the expected duration that we take it for, who is it prescribed by, and just any extra information that's very helpful, like were there side effects or did it help, and how do we know if it's helping? So that's just one example there. The website for this template is there too, but just reminding you that there will be a template provided for you as well. And an example of a medication list, there are so many different ones online. I'll give you a template, but you can also get a template from your community pharmacy. They can print a medication list for you, but always it's important to add any missing information to it so that it's accurate. Okay. Now, so we talked about the different kinds of lists, like a record versus a list. Now, here's where a lot of people run into some issues, because now it's about how do I fill this out? And I see this all the time. And I've used the word medication throughout, and I'll use it a lot this presentation. But most people think of medications as prescriptions, but actually the actual definition is a lot broader than that. So, what is a medication? A medication is anything that you put on your body or in that can affect your health. So, a complete medication list or record should include not only prescription medications, but over-the-counter products, vitamins, natural products, traditional medicines, and also substances like alcohol, nicotine, cannabis. Right? So medications also come in different forms. They come in inhalers, patches, and you won't believe the amount of times I see patients for medication reviews, and then I would be like, well, is there an inhaler that you also take? Oh yeah, but it's at home. And it would be something that is absolutely part of your medication list and should be discussed and brought to appointments as well. So, and a lot of times I'll hear, oh, I didn't think my vitamin or herbal supplement counted, but it does, because these things can interact and give side effects. It's just that people don't think to think about it that way, right? So, if they affect health and affect prescription medications, it should be included just as much as prescription medications are. Okay, so I hope that clarifies it. It's a nice little summary slide for us. So the next way we help someone manage their medications is to help review them regularly. So a medication review with a pharmacist, a nurse practitioner, doctor helps maintain an accurate list of your medications and for your healthcare provider, and it lowers that risk of medication errors. I mean, the purpose is quite simple. We want to make sure medications are safe, necessary, they're working the way they're supposed to. And something that I feel like doesn't get mentioned enough is actually, how do you prepare for this review? Because you really get what you put in, so to speak. So in my line of work, a lot of times patients will come to me, when they first come to me, they're surprised by the amount of detail that we're able to dive into with their medication when there isn't such a rush. So if you plan on having that review done at the pharmacy, for example, I know that they're very accessible and you can quickly speak about your medications, but I highly recommend booking a dedicated time with the pharmacist to sit down, review all the medications. And the same thing goes if you're ever booking an appointment with the family doctor. It's helpful to ask the office what length of time could be provided to you so that you can prepare accordingly. That's the first part. The second part is, please bring all the medications and the medication list. So it's not one is substituting for the other. The list is meant to work together with your medications to verify that information, and also something that you can update in real time as you're there in the office or seeing that person. And then finally, it's preparing a list of questions that ahead of time that you might want to ask about the medications. And later on in this presentation, there is a part where we're going to talk about how to talk to healthcare providers. And there's a little summary of what kind of questions to ask about medication. So I hope that should help with that. Okay. The third way that we help our loved ones, and this seems very obvious, is to help them take the medications correctly. But sometimes there's a lot more to it. So as a caregiver, we want to make sure that the correct medication is picked up from the pharmacy. Seems simple, but there are safety checks. You're that second safety check after the pharmacy sometimes. So that means is that the right name on the packaging, the medication, and the right medication that's for the patient, right? So other parts to this are timing, like taking the medication at the right time. But sometimes that's not so obvious because a prescription might say take it 4 times a day. But does that mean every 6 hours, or does that mean 4 times during waking hours? So make sure to ask for that clarification so that you're helping time that correctly. Same thing with instructions. Some instructions are very strict and others are flexible, and some things are taken as needed. So knowing that difference and being very clear about that. And finally, of course, food. So knowing if a medication should be taken with food, but more importantly, why? Because sometimes I have patients will come to me and be like, "Oh, I take everything with food," and it may mean knowing why is helpful, because does that mean are we taking that because it helps the medication work better, or are we trying to avoid a side effect, or maybe there's really no difference taking it with food or not, and we're just complicating things. So when in doubt, ask the pharmacist. Keeping medications stored and disposed correctly also matters. And I know there's a lot on this slide, so I'm just going to highlight sort of the most important point you may have already heard, but please make sure all medications are kept in one place together if possible. Now, some medications have to be kept in the fridge as opposed to room temperature, so that's a difference there. But how medications are stored also matters, because temperature, humidity can cause these medications to spoil. So storing them in a cool, dry place, and that just means not the bathroom and not the car and not that basement that has humidity issues. And so keeping them in original labeled containers. And finally, it's best not to keep old, unused, expired medications at home. It causes confusion. So it's best to bring them back to the pharmacy for safe disposal, so that it can be taken care of. And very importantly, if there are any needles that are being used at home for injections, make sure you have a sharps container that you can get for free from your pharmacy. So it's not something you should have to purchase at all, so that you can safely dispose of any needles. Now, how we organize medications will make a lot of this easier to manage. So let's talk about what our options are. So for us, we have about 4 main options on how most patients will organize their medications. Although I have seen some very strange organization strategies that I'd rather not encourage here. And each one has its trade-offs, but the one I wanted to highlight the most, that I've seen prevent medication errors and issues the most, are blister packs. Sometimes they're also called compliance packaging. Now, if you're somebody who's overwhelmed with caring for a loved one, if there's a lot of complex medications that have been challenging to keep track of, bring to appointments, then organizing medications in the blister pack is the way to go. A blister pack is a package just with all prescriptions that a patient takes every day, organized by the time of the day, like breakfast, lunch, dinner, and bedtime. And it's created by the pharmacy and it's checked by the pharmacy to make sure that everything in there is accurate. Some pharmacies also can include over-the-counter products like your vitamins and supplements into the packaging. So you would start this process by talking to the pharmacist, who then can provide you those details on how to do this or how to get started as well. Typically, there is no additional cost to it, but always check with the pharmacy as well. Some drawbacks to blister packages is that they're bulky and sometimes they can be trickier to open, but it really depends on the pharmacy and the packaging they use, because I've seen some blister packs that are really meant to be opened easily by individuals with arthritis or pain in their hands. So it's something to bring up in your conversation. The most common version I see, in all honesty, is dose set boxes or pill organizers that patients have at home. And I wanted to make sure that in terms of the pros and cons, a big one is that there is a higher risk of medication errors because it is on the onus of the caregiver to fill in those medications correctly into each day, and also remembering what medication is for what, and the names of it is not there. Compared to the blister pack, you'll have the name of the medication, and sometimes the blister pack will also have a picture next to the name of the medication on the inner part of the booklet. So really all that information is there. It's accurate. You can see where is what during morning, night, and day. So it's much more helpful than that pill organizer. The other parts that like we'll see are typically everyone knows the vials, which are also called medication bottles. And one thing that some caregivers aren't aware of, that if we're using vials and there's a lot of difficulty with opening those vials because of arthritis in the hands or physical limitations, you can ask the pharmacy to provide snap caps, which are much easier to open these bottles instead of in case that ends up causing issues with medication compliance. Another part of organizing medications might be might be a tough time for some patients who have visual impairments, because maybe those strategies may not work for them. And that can be very challenging, like small labels, similar looking bottles can cause mix-ups. So some strategies that can help is asking a pharmacy, just the basic part of it is if they can print larger labels. Not every pharmacy can, but some can. But there is something that's come up in the market a bit more recently that even I've just gotten aware of last year. There's something called a technology called Script Talk. And what it is, it's a device that reads out loud prescription labels from each file. So it actually converts any prescription information into spoken text. It's only available at certain pharmacies in Ontario, but it is free. There are no prescription or subscription fees. So if that's something you think that would benefit a loved one, I'd start with just calling or speaking to one of those pharmacies and seeing how you would get started. You can also reach out to the company directly as well. But I thought that was something neat and something I haven't even heard of before. So hopefully that can help. And apart from just organizing our medications or loved one medications, there are other ways we can help keep them on track. And these go hand in hand very well with packaging. And so they seem like common sense, but they're very effective, especially when more than one strategy is used. So having a routine with medications helps keep them consistently taking them. Using reminders. Now, unfortunately, a lot of our reminders that we're limited to are more technological. So alarms on the phone, or we have smart devices at home, or smartwatch. Sometimes there are apps as well that can help remind with set reminders for taking medications. Timing medications with meals, if appropriate, can also help. And of course, ask the pharmacist or doctor whether it would be appropriate to take the medication with a meal. Keeping medications all together in one place that's easy to find and is not affected by any temperature issues. We've talked about optimizing our medication packaging, finding the right packaging that simplifies errors and reduces them from happening. And of course, the one that I mentioned for most people know is using one pharmacy only to fill your medications. You'd be surprised the pharmacies aren't interconnected where they can see what is filled at different pharmacies, unless if it's a controlled narcotic substance. So if you're looking for someone to make sure that a pharmacist looks out for your drug interactions or side effect concerns, it would be best to do that when you have everything at one pharmacy so they see everything there as well. So what happens if our loved one or family member we're caring for, what if they say, no, I don't want to take my medication? And that can be really frustrating because, especially when we feel like it could have a negative effect on their health. And honestly, there's different strategies to keep in mind, but the most important one and the most effective one is finding out why and listening without any judgment. Because there's so many different reasons why a patient or our loved one does not want to take a medication. It could be a side effect. It could be something to do with how the size of the medication and just trouble swallowing. It could be they're worried about a side effect. So maybe the timing of the medication needs to be adjusted. Maybe they feel like, oh, I'm taking way too many pills in the morning and I just can't do it. It's just too much. So before anything, of course, is ever adjusted, and um, having that conversation is always easier with a pharmacist or doctor before any changes happen. And also missed doses happens to the best of us, hopefully not at all often, but it's always good to speak to your healthcare provider to know, well, what do I do if that happens? And lastly, never try to force a medication onto someone, but if you're concerned about a loved one's competence, always speak to the doctor first and go from there. So last but not least, I mentioned earlier was a big part that caregivers play is about monitoring, watching and reporting for side effects. This is where we really shine in this because oftentimes caregivers are the first to notice a change. We're around the patient a lot, we're around our loved ones. So if there's a new symptom that could be a possible side effect, don't automatically write it off as, oh, it might be just be aging. You want to make sure you document it, treat it as is this a possible side effect? And then bring that information back to the pharmacist or doctor and speak to them about it to confirm that that could be the case. Right? So just something to not undervalue. It's so helpful. The sooner we find that there's something not going right, the sooner we can do something about it. And of course, as we start to look for answers around what's happening, like all of us, it's also good to look for good sources of information. So this is the part where I want to make sure we have a good idea of where we should read information or who to go to. And we've all done, and maybe we've all been guilty of the late night searching. So I just wanted to make sure we all had a good idea of what trustworthy sources look like. So finding reliable medication information is important in this day and age with social media. There is a huge boom of it, and there's a lot of information out there, and there is a lot of information that can be very much exaggerated, even when it's well-meaning advice from friends and family or neighbors. It's not expert advice. So be wary of anything that claims that it can cure everything. And so on, right? So a good trustworthy resource is something that's written or reviewed by a healthcare professional, that's current, it agrees with other good sources. They're not trying to sell you on something. And there's also something like when you're going online and if you see a lot of ads, that's really a big tell that something's not right here because a lot of very credible sources don't have ads like government websites, organizations. And a good habit is to confirm the information with your own pharmacist and doctor who know your medical history much better before acting on any recommendations you might read or hear about. And even if that's coming from a doctor or pharmacist on TV, you still want to make sure you check with your own healthcare team. So some trusted medication resources are listed here. You will also get a handout around a list of these. For the interest of time, I just wanted to make sure I highlighted them and you can go through them, but there's many good ones. A very obvious one is speaking to your healthcare team. There's a Health Canada website. There is Health 811. It's similar to or the same thing as telehealth, where you can speak to a nurse or a healthcare provider through the phone. And there are other ones around medication safety tips, and there's other medications around herbal product information and side effects. So you will have that list so you can refer to as well. So what about our own opinions? You notice on many of those lists, I never mentioned or written like the patient's opinion and so on. And that's not to say that it's not reliable. It absolutely is actually very important a source of information. So it's because at this point, like yourself or your loved one, you guys know what this medication feels like for you. You're living that experience of oh, this is how I'm feeling. And the best person to know that is you. So there's really two kinds of expertise I mentioned earlier. There is you and your loved one, and that bringing that lived experience. And then there's your healthcare team who hopefully knows some medical stuff. And the best decisions happen when both perspectives are shared. And, you know, I can feel really sometimes intimidating or overwhelming to know how to make that conversation happen. And so I'd like to go into the next part, which is knowing, well, what kind of questions should I ask and when should I ask them so that we can, you know, create the best kind of decisions for medications. So useful questions that we want to have in mind. I mentioned earlier there's a 5 big questions about medications that are nicely summarized in this document. And whenever you see your doctor, nurse, or pharmacist, it's great to have answers to these. And notice that a lot of these questions will also end in why. This is important. So have there been any medications changed and why? And should I be continuing these medications and why? And then the way about the instructions, like how do I take these medications and for how long? And how do I know if it's working for me? And what side effects should I look out for? And what's the follow-up plan? Do I need to do blood work? When do I book an appointment? And so on. So these are extremely valuable. We should have these answers to them so that we feel confident to know what's happening with the medications. And now we want to know, when do we ask these questions? Well, technically you could ask them anytime. It's anytime you want or you feel like you have that question, but it's even more important to ask it when there are situations where there could be higher risk of adverse events or side effects from medications. So when people start medications, when your loved one is taking a medication, when there's an adding a medication, reviewing the medications, and of course, even stopping the medications. So, and then additional moments in someone's care is when when somebody has been in hospital and they've been discharged, or they move to long-term care. So these are also very important moments because that's when medications can be missed, omitted, errors happen. So that's something to keep in mind, especially then. And the final part around here is I want to know, well, what can a pharmacist do for you? Since that's a little bit of my bread and butter. So pharmacists are very well known to be accessible easily for medical advice. You can stop by, ask a question to a pharmacy, you can make an appointment, you can call in. So it's good to know how pharmacists can support you and your loved ones because sometimes they're the first person you end up talking to for medication questions. So I mentioned before about medication reviews. Sometimes the term meds check is also used. You might have heard that. It's to indicate that that's a medication review as well. It's what it's called. They are free in Ontario for patients who are Ontario residents, who have a health card. And they are free if you qualify for that if your loved one is taking 3 or more chronic medications, or they have diabetes, or they were recently discharged from hospital. And there's even the option that a meds check can be done in the home if there is difficulty leaving the home. So that's something that most people don't really know, that if I'm not able to get to a pharmacy, so that's something that you can discuss with the pharmacist to come to your home to do a medication review. Apart from those medication reviews, pharmacists can also help renew medications for a short period of time. They can do vaccines and injections. They can help with smoking cessation and prescribing for smoking cessation. They or help organize and maybe even simplify your medication regimens. And of course, there's also more recently a growing trend around pharmacists now being able to prescribe for minor ailments. And that list is continuing to grow. They're actually adding more things that a pharmacist can prescribe for from July 1st. So in about 6 days, so or 5 or 6 days. So I have a handout separate so that it summarizes all the minor ailment conditions that a pharmacist can prescribe for. Every pharmacy may have different kind of rules or things that they are comfortable with prescribing, but it's something to just call and ask about if that's something that they are able to do for you. Okay, So let's bring it all home with what can we do next? So this is a little bit of a checklist I tried to create to see if that can match also how in improving our confidence when we take care of our loved ones' medications. So keeping an up-to-date medication record and medication list and bringing that to every medical appointment. If there's anything that you take away from this presentation, I hope it would be that and how important it is. And it's something that's often overlooked in terms of where it fits into a person's journey with medications. Reviewing the medications regularly with a pharmacist or doctor and bringing those medications with you to that appointment. And that also includes over-the-counter products, vitamins, supplements. Another one is to making sure we only use one pharmacy to fill medications. There are very few exceptions. There can be exceptions where some medications may need to be filled at other pharmacies because they're specialized, but other than that, it should just be the one pharmacy we go to. Asking your pharmacist before you decide to add any over-the-counter vitamins, supplements, and natural products, whether it would be actually safe with your medications. That's a really undervalued also point. Like a lot of times when I remember like work in a pharmacy, I'd see people hovering around in their aisles and picking up things and so on. And it's very, we're in a rush. We have everybody's has a busy day, but it's sometimes those over-the-counter products can be just as dangerous as some prescription products. And it's great to then have that conversation too with the pharmacist, say, hey, I'm thinking of, I'm struggling with this, and that starting that conversation, making sure it's safe, will help reduce medication issues. I'd mentioned about using reliable sources of information to learn about medications. That's so important because there's a lot of information out there and a lot of it can be so inaccurate. And last but not least, watching for changes, reporting side effects early, and of course, never stopping a medication on your own until you speak with a doctor about them. And that would conclude the presentation. That's everything. Thank you so much for all your attention and your energy.